Methotrexate is commonly used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. Methotrexate can be used by itself, but also it's frequently combined with other medications to control your disease. Methotrexate works by turning down parts of the immune system that are revved up in RA and other conditions. It helps get your body's inflammation back under control. When people first hear about methotrexate, they're often concerned because this medication is also used to treat some forms of cancer. But it's very important to remember the doses that rheumatologists use are hundreds of times smaller than the doses used for cancer. Therefore, many of the side effects seen with chemotherapy are not seen with the lower doses. Methotrexate has been used to treat autoimmune conditions since the 1980s. Its safety record and the doses that rheumatologists use, which are about 15 to 25 milligrams a week, guidelines for monitoring these side effects are all well established. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate is taken once a week, not every day. It can be given as pills or in an injection. So you will choose a day of the week that works best for you, for example, Sunday. You'll then take your methotrexate every Sunday. Before taking this medication, your rheumatologist will check to make sure you're able to take methotrexate. You may not be prescribed methotrexate if you have cirrhosis of the liver or other liver diseases, if you have certain lung conditions, if you're a woman who is pregnant or trying to get pregnant, if you're a man who is trying to get someone pregnant, you have blood cell disorders such as anemia, which is a lack of red blood cells, or leukopenia, which is a lack of white blood cells, if you're breastfeeding a baby. Methotrexate can cause birth defects in the unborn baby. You should be on a sure method of birth control while taking methotrexate, whether you're a man or a woman. Tell your doctor right away if you become pregnant during your treatment. You may need to have a negative pregnancy test before starting treatment. Once you stop taking methotrexate, you should continue using birth control for at least 90 days before attempting pregnancy. Methotrexate is broken down by the liver. We generally recommend that people drink no more than 1 to 2 alcoholic beverages per week to minimize the chance of liver injury. Methotrexate comes in both pill and liquid form. Methotrexate pills usually come as 2.5 milligrams. You will be instructed how many pills to take once a week. For example, if your rheumatologist wants you to take 20 milligrams, that would equal 8 pills a week on your selected day. You can also take methotrexate by liquid, by mouth, and you will be given a syringe without a needle, and you would measure out the amount of liquid to take. A third way to take methotrexate is by injection. Your body may be able to process methotrexate better if it's given by injection. Also, injections may reduce upset stomach that methotrexate pills can cause. There are several types of injections with videos describing them. The links will be at the end of this video. Your doctor, nurse, or pharmacist can answer any questions you have about how much methotrexate to take and how often to take it. You want to store pills and injections at room temperature, away from moisture and heat. And if it's a liquid, store it also away from light. If you miss a dose of your methotrexate, talk to your doctor for instructions.